General pharmacology. Parasites is derived from the Greek word salam. Okay, the parasite is derived from the Greek words. Para means beside, cytos means food. The first recorded parasitic infection in man is schistosomosis. The Bible worm is known as the guinea worm. The worm which absent anus is dracunculosis. Father or founder of parasitology is Francisco Redi. American parasitology's father, Pentaso. Imedia stereo was discovered by the Antony von Leeuwenhoek and it was the first protozoa discovered. Theileria parvae was discovered by the Koch. Self-cure phenomenon was described by Stoll. The lapworm vaccine was developed by Jarrett and Conwacker. The first mammalian trypanosomosis was Adavas. Trypanosoma louisi. Monacia life cycle was explained by the M. Anandaramo. Heterogenetic association, symbiosis, mutualism, phoresis and commensalism. Commensalism means eating from the same tables. Phoresis means try to carry. Symbiosis means living together. World's largest intracellular parasite is Trichinella. Hyperparasites means the parasites on other parasites. Auxiliary parasites means hyperparasite used to kill the other parasites. Aberrant or ectopic parasites means the parasites seen in the normal host but in unusual site. Accidental parasite means they are the free living organism. In some of their life cycle they will be seen in other host type. Incident parasite means the parasites which are seen on unnatural hosts. The stray parasites is the combination of aberrant parasites, accidental parasites and incident parasite. Parasitoid means some parasites laid egg on a host and that egg, the larva will be developed that will cause damage to the host. Spurious parasites means the parasites which are found in unnatural host but they will merely passes through the intestines to emerge out through the fecus as a living or dead one. Monogenetic parasites means all the stages of their life cycles are parasites and the heterogenetic means some of the stages are non-parasitic. Example Strongyloides papillosis. Proteolyne parasites in examples are Estrus ovis that is the larval stage is parasitic. Monogenous അല്ലെങ്കിൽ homogeneous means they have only one intermediate host in their life cycle. Heterogeneous parasites, more than one intermediate host in their life cycle. Best stain for the parasite is Gisma stains. Chemical used for the permanent parasitism is Canada balsam. Facultatively heterogeneous parasites are more than one. Facultatively heterogeneous parasites, an example Toxoplasma gondii. Obligatory heterogeneous parasites, an example Sacrosis tyricum. Auto-heterogeneous Trichinella spiralis. Uri or the polygenous wide range of host. Stenogenous means narrow range of host. Paratenic host, potential host which transfer infective stage to another. Carrier host means they merely carry the infective organism. Convalescent host means they are cured from the clinical signs but they have minute amount of parasites in it. Reservoir hosts are the natural definite host of the organism. Anthropozoonosis are those zoonosis which spread from animal to human. Zoonoanthroposis from human to animals. Amphizoonosis means both directions. Periparturient rise in fecal sample head count can be seen in sheep. Cyclozoonosis means they have only vertebrate host in their life cycles. Type 1 and type 2. Type 1 is known as obligatory cyclozoonosis, Taenia solium and Taenia saginata. Type 2 is non-obligatory. Examples Hydatidosis. Metazoonosis. Type 1 zoonosis means one vertebrate host and one invertebrate host. Schistosomosis. Type 2 means 1 and 2. 1 and 2 intermediate host and paragonomosis. And the type 1 3 2 vertebrae 1 intermediate host and clonorchis ennu paraya. Clonorchis. And the type 4 is 1 vertebrate host and transovarian cycle transmission, tick encephalitis. Saprozoonosis means they have a vertebral host, invertebral host and inanimate object for develop. Examples facial histoplasma. develop phaseoplasma, develop histoplasma, propagate ankylostoma brasiliensis, cyclopropagative fasciola, saproanthropozoonosis, erysipeloid, saproanthropocenosis, histoplasma, saprometaanthropozoonosis, fasciolosis, saprocyclozoonosis, tick paralysis.